If I told you there was a health intervention that could help lower your blood pressure, cut your risk of heart attacks, drop your blood pressure, boosted your testosterone, improved your blood sugar, and reduced the risk of dementia, sharpened your memory, and made you 20% less likely to catch whatever's going around, and it was free, you'd want to know about it. That intervention is sleep. 7 to 9 hours of it, consistent, uninterrupted. And most of my patients, and myself as well at times, are getting 5 or 6 hours of broken sleep and thinking it's normal. Hi, I'm Kevin Davis. I'm a family practice physician assistant here in Knott County. And today I'm going to walk you through what sleep actually does for your body, what it costs you when you don't get it, and the 5 rules that will fix most people's sleeps within 2 weeks. Now, what happens actually in your body at nighttime? Sleep isn't just off time. Your body's doing a huge amount of work while you're asleep. It moves through 4 stages, cycling every 90 minutes. Stages 1 and 2, light sleep, transition, slowing of the heart rate, slowing of the breathing. Stage 3, deep sleep, also called slow wave sleep. This is the physical recovery stage. Growth hormone gets released, muscle repair happens, your immune system runs its overnight cycle. Most of your body's biggest hormones events happen during deep sleep. Then REM sleep, rapid eye movement. This is where dreaming happens. Your brain consolidates memories through the day. Emotional processing gets done. And if you've ever noticed how bad a day feels less overwhelming after real sleep, that's REM sleep doing its job. And here's the part that really blew my mind when I first learned it. Overnight, your brain literally cleans itself. There's a system called the glymphatic system that opens up during sleep and flushes waste products out of your brain, including a protein called amyloid, which is the same protein that accumulates in Alzheimer's disease. Chronic poor sleep may be a real driver of dementia risk over the decades. At the same time, your blood pressure drops overnight, called dipping. The insulin sensitivity resets. In men, testosterone rebuilds overnight. And in the last few hours before you wake up, cortisol rises to prepare you for the day. Now, if you skip sleep, you skip all that every night. What chronic poor sleep is costing you when you are consistently sleeping under 6 hours a night, here's really what's happening over months and years. Cardiovascular system, higher blood pressure, higher risk of heart disease and stroke. The dipping that's supposed to happen overnight doesn't happen properly. Metabolic, insulin resistance goes up. You'll gain weight even eating the same amount of food. Your blood sugar becomes harder to control if you're type 2 diabetic. Hormonal, testosterone drops in men, and this is a big one that hardly anybody talks about. Ghrelin, your hunger hormone, goes up. Leptin, your fullness hormone, goes down. You're literally hungry all day on a bad night's sleep. Your mental health, depression, and anxiety are strongly linked to poor sleep. In fact, treating sleep sometimes fixes what looks like depression. Your cognitive, your attention, your memory, your reaction time all suffer. Driving after 20 hours awake is comparably to driving legally drunk. Immune system, you catch more colds. You respond less well to vaccines. Chronic short sleep is inflammatory. Long term, increased risk of Alzheimer's, increased risk of some cancers, higher all-cause mortality in people consistently sleeping under 6 hours a night. Sleep is not a luxury, it's medicine. Now, sleep apnea, the elephant in the room. Before we even talk about the 5 rules, I have to talk about sleep apnea. Because if you have sleep apnea, no amount of good sleep hygiene will fix it. You actually need treatment. Sleep apnea is when your airway collapses over and over during the night, dropping your oxygen and dragging you out of deep sleep without you even knowing it. You wake up exhausted. Your partner says you snore and stop breathing. The signs of sleep apnea: loud snoring, your partner reporting you stop breathing, waking up with a headache, dry mouth, waking up unrefreshed no matter how long you slept, falling asleep at the desk or at the wheel in the afternoon, blood pressure that won't budge on medications. It's widely underdiagnosed. especially in women and in regular sized people. It's not just a classic big guy who snores. Ask your provider for a home sleep study. It's cheap, it's easy, and if you have sleep apnea treatment, usually with a CPAP machine, changes lives. I've had patients tell me that they didn't know what rested meant until they started using one. If you snore or wake up tired, get evaluated. This is the single highest impact fix on the whole list for the right patient. Now the 5 rules. Do these for 30 days and most people will feel like a different person. Rule 1. Same bedtime, same wake time. Every day, even weekends. The body runs on a rhythm called a circadian clock. It works off consistency. Saturday to Monday, jet lag is real. Pick a bedtime and wake time you can hold to 7 days a week, even if it means an earlier weekend bedtime. 2 weeks of consistency and your sleep quality changes. Rule 2. Dark, cool, quiet. Blackout curtains if you can. They're a game changer for me. Room temperature 65 to 68 degrees Fahrenheit. Your body cannot drop into deep sleep when it's hot. A cheap fan for white noise if your neighborhood is loud. Get the TV out of the bedroom. Rule 3. Phone out of the bedroom. Buy a $10 alarm clock and leave the phone in the kitchen. The phone in the bedroom is the biggest destroyer of sleep in the modern era. Both the light and the temptation to scroll. If you can't imagine doing this, that in itself is a sign how badly you need it. Rule 4. Last caffeine by early afternoon. Skip late alcohol. Caffeine has a half-life of 5 to 6 hours. A coffee at 3 p.m. means half the caffeine is still in your system at 9. Alcohol makes you fall asleep faster, but destroys the deep sleep and REM sleep. A couple of nights a week is fine for most people, but if you drink most nights, that's the reason you're tired. Rule 5. Morning sunlight in your first hour of awake. Your body clock is set by the first light hitting your eyes. Kitchen lights and screens don't count. Step outside, even on a cloudy morning, for 5 to 10 minutes. Your sleep that night gets deeper, your mood is better that day, and it's free medicine. Now, melatonin, magnesium, and sleep medications. Melatonin. Helpful for jet lag or shift work. Not great as a nightly sleep aid for most people, especially adolescents. Small doses, no more than 1 milligram, work as well as bigger doses. The 10 milligram dummies most people get in the store are way overdone. Magnesium. Magnesium glycinate before bed helps some patients with sleep quality and muscle relaxation. Low risk, cheap, worth trying. Prescription medications like Ambien and Lunesta. They have their place, but they're not a long-term solution. They also don't produce the same kind of respiratory sleep as natural sleep. You need to talk to your provider, but don't self-treat with borrowed pills. A sleep aid that you don't need to take is CBT1, Cognitive Behavioral Therapy for Insomnia. If you have chronic insomnia, this is more effective than any medication and has no side effects. Ask your provider about it. Fix the basics first. Reach for supplements or medications only after that. Now, what's different for men and women? 2 quick gender-specific notes. Women in perimenopause and menopause, hormone swings can destroy sleep. Hot flashes and night sweats can wake you up. Estrogen affects sleep directly. If you're a woman in your 40s or 50s whose sleep has fallen apart, that's perimenopause conversation that needs to happen. I've got a whole video on a channel about that. You can watch that later or get in contact with me. Men, sleep apnea gets worse with weight gain, particularly around the neck. And here's the part that most men aren't told. Poor sleep crashes testosterone. If you're a man in your 40s or 50s who's tired, cranky, gaining weight around the belly, and losing libido, fix sleep and get an apnea evaluation before you assume you need TRT. A lot of times TRT is down because it's a downstream effect of bad sleep. For wives and daughters and husbands reading this, if the man or woman in your life snores badly or wakes unrefreshed on most days, help them make the biggest decisions they need to make and get a sleep study right away. This is one of the biggest quality of life fixes in medications. So, what can you do this week? Don't try to fix or do all 5 rules at once. Just pick 1 or 2. This week, same bedtime, phone out of the bedroom, just those 2. Let's see what happens by day 10. Next week, add morning sunlight and cut out caffeine by 2 p.m. The week after that, dark, cool, room with less late alcohol at nighttime, or better yet, no alcohol at all. If you snore or wake up exhausted, no matter what, book that sleep study along with all this. You don't need to wait on that. So, when do you need to call your provider? There's 5 reasons I see why you need to call your provider this week. You snore loudly and wake up unrefreshed. Your partner says you stop breathing at night. You're falling asleep at the wheel or at your desk. Insomnia that has lasted more than a month. And also any kind of new morning headaches. Sleep is not a weakness. It's medicine. The people who look and feel their best over decades are the ones who have protected their sleep. If this has helped you, subscribe. I do this every week. Share it with somebody whose sleep is really a mess. All my links are below, with a free newsletter to Kevin Davis Health and Second Half Davis Strong. I'm Kevin Davis, physician assistant. Take care of yourself, get some sleep, and I'll see you in the next video.